Hello Professor and fellow students. My name is Castro-Reyes and I'll be presenting my topic on the multistate outbreak of Salmonella due to consumption of raw tomatoes in 2005 and 2006. Foodborne illnesses continue to be a problem in the U.S. each year, and we need to find new ways while improving old methods to reduce and prevent the occurrence of foodborne illnesses. What is an outbreak? An outbreak is defined by the CDC as the occurrence of two or more cases of a similar illness resulting from the ingestion of a common food. And once an outbreak is suspected, cases and controls are compared. Data regarding symptoms, locations, time of onset are all collected. Statistical data is calculated. Samples of stool or blood are sent to the laboratory for examination. Interviews are conducted and hypotheses are generated and tested. If found to be statistically significant, an epidemiologic investigation is conducted and control measures are put into action. The outbreak is considered concluded when the critical exposure stops, meaning contaminated products are recalled, restaurants or food facilities are closed, food handlers are no longer infectious or working around food, and the investigation has provided clarification and guidance for future preventive measures. Surveillance methods. The CDC collects data from local and state public health departments and receives data from numerous surveillance and notification programs. One such program is the National Molecular Subtyping Network for Foodborne Disease Surveillance, or PulseNet. It analyzes through subtyping and categorization of foodborne bacterial pathogens using a standardized process of pulsed field gel electrophoresis, and this is especially important in identifying serotypes. The outbreak. In 2005 and 2006, 4 large multi-state outbreaks of Salmonella infections occurred. It involved 3 serotypes, and it was associated with eating raw tomatoes in various restaurants across 21 states. There were 459 culture-confirmed cases of salmonellosis in the 21 states. Isolates with indistinguishable pulsed field gel electrophoresis patterns were identified from stool specimens, confirming cause of outbreaks to be the following serotypes: Salmonella Newport, Salmonella brenderup, and Salmonella typhimurium. The investigation results from a case control study and environmental research study determined that the contaminated food product was tomatoes, whole or pre-cut, supplied to restaurants from tomato fields in Florida, Ohio, and Virginia. Slides 6 and 7 display data from these investigations showing the serotypes involved, the states affected, and the demographics of the patients and the sources of contamination. Current data regarding the mechanisms for tomato contamination and methods of eradication of Salmonella in tomatoes is incomplete. The agricultural industry, food safety agencies, and public health agencies will have to make it a priority to research the problem, which is especially important because tomatoes are a widely consumed product. Approximately 5 billion are consumed each year, and with our limited knowledge and recurrent outbreaks, we are left very vulnerable to future attacks. Salmonella. FoodNet identifies Salmonella as the most common bacterial infection reported in the U.S. It is a gram-negative, rod-shaped facultative intracellular bacterium which can penetrate ocular, nasal, oral, or intestinal mucous membranes. The bacteria resides in the intestines of humans, animals, and birds, and is transmitted to humans through contact with food contaminated by feces, or contact with contaminated water or infected animals. It can be present on raw meat, poultry and seafood, and eggs. Unpasteurized fruits and vegetable juices or dairy are dangerous as well. Reptiles can also harbor Salmonella, which can be dangerous for homes that have reptiles as pets. The bacteria Salmonella causes an infection called salmonellosis. The incubation period can last several hours to 2 days. The illness can last 4 to 7 days. Sometimes the infection can be asymptomatic, but symptoms that appear include nausea, vomiting, chills, headache, muscle pain, diarrhea which can be bloody, fever, abdominal cramps that appear 12 to 72 hours after infection. Some people can recover without treatment, but in some, hospitalization may be needed due to severe diarrhea or dehydration. The infection can move from the intestine to the bloodstream, causing septicemia, and then onto other body sites. People who experience diarrhea will recover, but it can take up to several months for normal bowel habits to resume. Some people develop pain in their joints, irritation of the eyes, and painful urination. This is called Reiter's syndrome and can last for months or years and lead to chronic arthritis. Diagnosis of the infection is done by identifying cultural isolates from stool. The elderly, pregnant women, infants, and people with compromised immune systems are especially vulnerable. Treatment involves using antidiarrheal medications, antibiotics, and replacing fluid and electrolytes. There are many methods to enforce prevention at home, such as proper hand washing, avoiding eating raw or undercooked foods, and be discerning about the restaurants where you eat. What can we do? In order to prevent future tomato-associated outbreaks, we need environmental and laboratory research to determine sources and routes of contamination, mechanisms that pathogens use to infect tomatoes, and the stage of development where the plant is more vulnerable, and how to reduce or eliminate this contamination. The FDA in July of 2009 proposed the Guide to Minimize Microbial Food Safety Hazards of Tomatoes, which helps assess the various parts of tomato production and how we can improve and enforce safety. One such area is the open field. We should assess the field site, assess the nearby land use, assess agricultural inputs, and worker health and hygiene. In packing houses, it is important to have food safety programs in practice to reduce risk of microbial contamination. Despite the variety of locations, capacities, and capabilities, it is important to have appropriate pest control and proper sanitation. These are a summary of the recommendations made by the FDA and can be applied to every aspect of tomato production and distribution. In slide 18, we discuss the Food Safety Modernization Act, which was signed into law by President Obama on January 4, 2011, and is the latest attempt to ensure the U.S. food supply is safe by shifting the focus from responding to a contamination to preventing it. It enables the FDA to focus on a more preventive action rather than reaction and response to problems. While this act would enforce better safety measures and guidelines, unfortunately, as with other issues, there is a struggle in Congress regarding the means to finance its implementation, so its potential benefits and success remain to be seen. Recommendations. In order to reduce the incidence and occurrence of foodborne illness outbreak, there is much improvement that needs to be done. We need improvement in farm animal hygiene, slaughter plant practices, and fruit and vegetable harvesting and packing operations. We need better education for food industry workers, for facilities and restaurants regarding storage, safe handling of foods, and handling food errors. And in the community, improved use of pasteurized and cooked food products. We also need better irradiation and other treatments to reduce contamination, as well as more research is needed to answer remaining questions. In conclusion, as public health officers, we need to show our local, state, and national government how important and necessary programs like the Food Safety Modernization Act and guidelines to reduce microbial hazards are to every aspect in our community. We should educate our local communities, schools, and other organizations, as well as patients, about better food safety practices. One such program provided by the USDA is the Clean, Separate, Cook, and Chill program that helps teach the community about good food safety practices. We have to advocate for the needed improvements and advancements if we are to progress in our knowledge base as well as promote public health. Each outbreak allows us to learn something new about the bacterial strains and their abilities, and we need to be able to apply these findings in positive, efficient, and effective ways if we are to have better control and defense against the pathogens. Thank you.